Christmas seals. For generations, Canadians have used the colorful stamps to decorate holiday greeting cards and parcels. This tradition began a century ago as a way to raise funds for the fight against tuberculosis. They proved to be powerful against TB and remain a powerful symbol even today for those with lung disease. Christmas seals, a much-loved symbol of hope and good cheer for all Canadians. The Lung Association story began in 1900 when tuberculosis was the #1 killer in Canada. The fight against TB was a people's battle. It went way beyond doctors and nurses. There was no public health system in place to fight the TB epidemic, so the common people had to do it themselves. Back then, very little was known about TB, or consumption as it was called then, except that it was deadly, highly contagious, and incurable. Every time the clock struck the hour during the day, another Canadian died of TB. And every time the clock struck the hour during the night, 2 more died of TB. There was a great stigma attached to having tuberculosis. Once it was discovered that TB was caused by a germ and wasn't hereditary, and that TB was contagious, some consumptives became outcasts. TB hospitals, called sanatoria, offered isolation in rural settings where, over a lengthy period of time, TB patients might regain their strength. The rich could afford lengthy sanatoria treatment, but in the days before universal health care, the poor could not. In 1900, Lord Minto, the Governor-General of Canada at the time, launched the national movement against tuberculosis in Canada at Rideau Hall, where he called the first meeting of what was to eventually become the Lung Association. Several very concerned citizens gathered to form a national anti-tuberculosis association to fight the deadly epidemic. There was no money. There were no resources, just dedication and drive. At that time, Canada had no Department of Health, and there were fewer than 50 tuberculosis treatment beds in the entire country, although 10,000 people died from tuberculosis that year. Canada needed more TB sanatoria, and resources were needed to educate the public about TB. So with that in mind, we issued the first Christmas seals in 1908 in Toronto, Hamilton, and Winnipeg. Other cities across Canada joined, and 1928 marked the first national Christmas seals campaign. Dr. George Porter was a trailblazer for the association. As executive secretary in 1908, his only pay free passage on railways across Canada, Dr. Porter spread the word about TB prevention. During his first year, Dr. Porter visited every major town on the Canadian Pacific Railway, from Victoria to Sault Ste. Marie, giving lectures about TB. Dr. Porter was a great orator and talked to anyone who would listen. He encouraged a grassroots movement, urging everyone to become involved in the fight against tuberculosis, establishing local and provincial TB organizations, building TB sanatoria, initiating traveling TB clinics, and convincing governments to increase the number of visiting nurses. At first, the only treatment for TB was bed rest, fresh air, good food, and more rest. And even then, thousands died.
Melville. John Timbeck, Lemsford. Hugh Urquhart, Square Hill. Lillian Galloway, Lake Valley. Violet Helen Duff, Empress. Keith Haviland, Pinkham. Reginald Bowerman, Oxbow.
TB was contagious. People who had TB had to be isolated from society, from their families, from their friends, lest others also catch TB as well. Those who could afford it went to sanatoria for many months and years to either recover from their disease or die. Early on, Canada set out to provide sanatorium treatment for tuberculosis patients. When the Muskoka Free Hospital opened in 1902, it was believed to be the first free TB sanatorium in all the world. In 1929, Saskatchewan became the first province to offer free treatment to all TB patients. This laid the groundwork for the introduction of Medicare by Premier Tommy Douglas 30 years later, and it paved the way for the universal healthcare system we have today. In Canada, Christmas Seals campaigns played an important role in public health from sea to sea to sea, and they symbolized the grassroots support that waged and won the fight against tuberculosis. Billboards and parade floats kept TB in the public's eye. These campaigns informed people that TB was preventable and treatable, especially when diagnosed early. Funds raised by Christmas Seals helped the anti-tuberculosis organizations across Canada to provide public education, fund research, and train TB doctors and nurses.
Christmas Seals provide funds to prevent tuberculosis. The Sanatorium Board gratefully acknowledges the support of thousands of Manitoba citizens who buy and use Christmas Seals, helping finance free clinics, saving countless lives. Christmas Seals work the year round to protect your home from tuberculosis.
Early diagnosis of TB was key, and chest x-rays could reveal TB in the lung. Because the TB epidemic was so widespread all over Canada, the association encouraged, and in some provinces conducted, massive X-ray campaigns across the country. Mobile X-ray units went all over Canada to diagnose TB, even in remote areas. Newfoundland launched its floating clinic, dubbed the Christmas Seal, and sailed the X-ray equipment from outport to outport. Many TB patients needed 3 to 5 years of treatment in a TB sanatorium. In 1938, the number of beds in Canada's 61 TB sanatoria had grown to 9,000, but still nowhere near the number needed. By 1953, there were 19,000 beds. After World War II, high rates of TB in returning vets caused a big spike in TB cases in Canada. Our membership grew. In 1946, a medical section was established for TB doctors. This group, in 1958, became known as the Canadian Thoracic Society. In 1948, a nurses section was formed. In 1960, a research committee. All these activities were made possible by donations to Christmas Seals. In the 1950s, antibiotics became the first real weapon to kill the TB germ. Time spent in sanatoria was dramatically reduced, and a miracle happened. TB sanatoria began to empty. During the 1960s, when TB started to come under control in Canada, we began sharing our hard-won knowledge with the developing world. With Dr. Bill Jeans as medical director of the Canadian Tuberculosis Association, as we were then called, our international involvement increased to a new level. TB is still the #1 infectious disease in the world. Every year, 1.6 million people die from TB. We share our world-class TB expertise with high-risk countries such as Ecuador and Peru. Because of our extensive history in fighting TB, the vast majority of knowledge about all lung diseases was concentrated in our association. As TB came under better control in the 60s and 70s, it was natural that we broadened our focus to fight other lung diseases. To reflect this, we changed our name to the Lung Association. Celebrities such as Chief Dan George, skater and Olympic medalist Toller Cranston, jazz pianist Oscar Peterson, and folk singer Murray McLaughlin helped promote donations to Christmas Seals and the association's good work. Our organization was built on and has relied on the efforts of many, both professional and volunteer, whose lifelong, diligent work has built the public health system in Canada that has benefited the health of all Canadians. Today, we continue our tradition of supporting education, prevention, research, advocacy, and treatment of lung disease. Even though TB is under control in Canada, it isn't eradicated. Every 20 minutes, another Canadian dies of lung disease. Almost 3 million Canadians have asthma. Sleep apnea is the most underdiagnosed chronic disease in Canada. 5 million Canadians smoke. 90% want to quit, but they need help. In 2008, 21,000 Canadians will die from the effects of air pollution. COPD is the fourth leading cause of death in Canada.
COPD takes the life of one Canadian every hour. One of those Canadians was Peter Zosky.
I'm Peter Zosky, and I have COPD, chronic obstructive pulmonary disease.
The Lung Association family includes a wide range of healthcare experts in the Canadian Thoracic Society and the Canadian Respiratory Health Professionals. This strong partnership, along with our century of service, makes us Canada's trusted voice for lung health. Our good work continues, and we are still at the forefront, leading the development of Canada's new lung health framework. Donations to the Lung Association provide funding for researchers who are developing better treatments and hopefully cures. Donations also support public education for awareness and prevention, patient education to teach coping skills and self-management, and advocacy to raise lung disease on the health agenda. Donations help improve the quality of life for those living with lung disease. Donations provide hope. Together with healthcare professionals, volunteers, and donors, we're working to help the 1 in 5 Canadians with breathing problems to breathe easier. Over 1 in 3 Canadians will be affected by lung disease at some point in their lives. The Lung Association works to improve life, one breath at a time. Because if you can't breathe, nothing else matters.